podcast will demonstrate the use of the 3M encoder encoding an outpatient using CPT codes. Some of you may have seen the 3M encoder demonstration in the PCS course. I'm going to be gradually putting it in all the courses so that students can see how these encoders are used in hospital and outpatient settings. The case I've chosen to code today is an excisional debridement of a diabetic ulcer. There's a document associated with this podcast where you can see the patient's information. The case I've built, 69-year-old female. This is recorded on June 12th, but the point is it was all done in one day. Bill type as a hospital outpatient with no condition code, and I'll show you in the podcast what condition codes mean. Diagnoses we'll be coding are the type 2 diabetes with a skin ulcer, long-term use of insulin, and a chronic ulcer of the right buttock with the fat layer exposed. Wound is a 22 square centimeter. First listed diagnosis will be type 2 diabetes with skin ulcer, and the treatment is going to be culture and sensitivity of the wound and excisional debridement of the ulcer of the right buttock. The product we'll be looking at is the APC finder, and the grouper is the Medicare APC hospital outpatient. So we've opened the encoder. Female has been chosen as the gender. Age is 69. June 12th, 19. Of course, it's an outpatient, so everything is done the same day. We're looking at the APC finder, and the grouper is the Medicare grouper, APC hospital outpatient. I'm going to select hospital outpatient, no condition code. I'm going to show you if there had been a condition. These are the conditions that the encoder is referring to. And none of these apply to me. So I'm going to go back and select hospital outpatient, no known condition. ICD-10 is the code set we use to code diagnoses. We're going to type in diabetes. And here's diabetes mellitus. It is type 2. This information is being taken from the document that accompanied the podcast. It's an ulcer, but it's not a foot ulcer. So we're going to go down here so we can spell out what we want to code. It's a skin ulcer. Not a foot, though. It's a buttock. I mentioned it's exposed fat layer. This is referring to if we had a hospital-acquired condition with a non-pressure ulcer. This does not apply to us. There's no more ulcers and no more complications. We do have long-term use of insulin, no other anti-diabetic drugs. So now we're looking at the treatment. We know from the document I've shown you that culture and sensitivity is going to be done as well as a debridement. Click on culture and sensitivity and debridement. Debridement, we have to answer some questions. It is skin. You can read the various choices there and see why you might have to choose which of these you were debriding, but in our case it is skin. It is an ulcer. And we mentioned it, the fat layer was exposed, and that is subcutaneous tissue. Stated in the document it was 22 square centimeters. If you look at your codes for debridement in the CPT code book and read the code descriptions, I believe this 11042 is 20 square centimeters or part thereof. If our wound is 22, then we're going to need two codes. So we think of it as two units. One is the 20 square centimeters, and the second code is going to cover that remaining 2 centimeters, square centimeters. And that's it. So now it wants us to code PCS. This is a version of 3M that academic institutions can use, and I don't know how to disable this so that I don't have to answer PCS questions. So what I'm going to do is just work through it as though, say the hospital wanted me to code CPT and PCS. I'm going to go ahead and work through the PCS questions. It is excisional debridement. It's the buttock, so I'm going to say sacral region because that's the closest to what I'm doing. And there's no other. Now it's saying, okay, you have chosen the CPT codes for culture and sensitivity. Nothing in PCS corresponds to that. and that we know that. So we'll just say OK. So now you have your diagnosis codes, your CPT codes, and your procedure code. Notice that the decimal or the point is not part of the encoder or a claim normally. You just know from your coding education, this is E11.622, L98.412, D79.4. How you would think about it if you were looking at the ICD-10 CM codebook. Here are your CPT procedures. I mentioned earlier the first 20 square centimeters is one code. Then each additional 20 square centimeters or part thereof, the second code. And here's the culture and the sensitivity. And then there's a PCS if we were coding PCS codes. This page, we're going to see the detailed explanation of things as far as APC goes. Every outpatient procedure code has a status. You see status T is applied because you've got multiple reductions. You've got two codes here that have to do with debridement. Then it tells you that these three are going to be all packaged into the APC rate for this, the first one. You can just read here. It's APC 05052, which is a level 2 skin procedure. And then it's telling you these three are packaged into this first APC code. If you look up at the top, it's telling you the total you're going to be paid as a facility is $312.41 for this encounter. And down at the bottom, you can read and see where it tells you the total is this, and then it breaks it out for you. Patient's copay is listed there, $63.50. Scroll down again and you'll see claim type is a single day procedure claim. There were no edits present on this claim. It's a hospital outpatient with no condition code. This is what will be referred to as a clean claim. Okay? So now what I want to do, I want to muddy the waters a little bit and show you what a claim would look like when hits would hit it. So let's say we're using the same patient, a 69-year-old female, no condition code, diabetes, type 2, the buttock ulcer, Boast fat layer, let's code the culture and sensitivity, debridement, remember we know 2 codes are going to be needed. Then we'll code the oxygenation. Let's add a procedure because I want to show you what an edit might look like. Hyperbaric, let's say. And there's a physician attending. 1 session and no more procedures. As I mentioned earlier, now the PCS wants me to go through that. So the excision we mentioned a while ago. But now it's telling us, as I mentioned earlier, the culture and sensitivity has no corresponding codes in PCS, but it also tells us this procedure code for the physician attendance at the hyperbaric oxygen therapy session. We're going to have to look up another code. We don't want to use diabetes as our original keyword, so we're going to say no. And I'm going to use oxygenation or oxygen to get me to that hyperbaric oxygenation. Intermittent, and there we go. Now we've got the same diagnoses codes we had earlier. We have the same procedure codes, except I've added this 99183, which is a physician-attended at hyperbaric oxygen therapy session. And then I have the PCS codes if they had been needed. Watch what happens when I go to continue. And we've got some problems here. The first thing I notice is an edit right here. Edit 0062. It's an outpatient code edit. Unless the code is not recognized by the outpatient prospective payment system, another code might be used for that same service and might be available, but it's telling you this code is not going to work. It's what would be considered a non-allowed item or service for outpatient payment. So that's a problem. Look up here, you see the same information we had earlier, where debridement requiring the two codes. First debridement code is a status T. Multiple reduction applies because there were two. The wound was big enough to require two codes. Here's your culture code and your susceptibility code. You notice that the second debridement code, the culture, and the sensitivity are all part of the package, this APC rate for this first procedure here. But because this edit hit, it's not even giving us a total here for your APC. So this claim is going to be denied because of this outpatient code edit. If you scroll down, you see it just tells you no APC payment, claim denied. It goes here, further explains claim denied, rejected, suspended, or returned. All line items denied or rejected with only prepayment edits. In other words, it's not going to pay anything until this edit is cleared up. This edit. So that's just an explanation of how you would use the 3M encoder, coded outpatient, as well as what it would look like if you hit an edit. If you have any questions, please post them in discussion board. I encourage you to use the directions I've given you to try to log in into this encoder. It's available on Citrix for students to be able to go in and play with it, see how it works. Students have had difficulty logging in, and I'm not sure why. You can call IT, and they will walk you through what might be some of the problems. Okay, that's all I want to talk about today. Thank you. Have a good day.